Hello, I'm Pinakin Davey, Professor of Optometry at Western University of Health Sciences, and it is indeed my pleasure to welcome you to this video lecture, Analysis of Visual Field Printout. Analysis of a visual field printout can be overwhelming for a novice observer. Today, we are particularly looking at the 7-in-1 printout from Octopus Visual Field Machine. The Octopus 7-in-1 printout gets its name from the fact that there are 7 main graphics that are represented in the printout. But there are a lot more data than just 7 places that we should look at. First, let's look at the reliability indices. The most important points of reliability indices are to make sure that the name of the patient is correct so that it gets recorded in the right database. The date of birth is very important because each patient's data set is compared to their age-matched normal. So if the date of birth is wrong, then the data is compared to incorrect age group. The other parameters that one should pay attention to is to look at the strategy of test that is performed. Here, this is a G protocol, top strategy meaning tendency-oriented perimetry. It is white-on-white perimetry, standard automated perimetry. The refraction, if it's input correctly, or sometimes you don't want any refraction to be put in, and the pupil size. Anybody that has a pupil size less than 3 millimeter, one should consider dilating, particularly if there is a cataract or a media opacity. The other important parameters to look in terms of reliability indices are the false positives and the false negatives, and they both should be less than 15%. Now when you come to the next part of the printout, you are seeing the raw data. The raw data is the most unaltered data from a visual field machine, that is the patient responses, and it's crucial to be looked at. From the raw data, we obtain various other graphics that we will see. Next up is the grayscale. The grayscale is a pictorial representation of the kind of visual field defect the person has. From the raw data, you're getting an understanding of what the patient responses are, and from when the raw data is compared to their age-matched control, you get the comparisons plot. And from this comparisons plot, they generate the grayscale comparison that shows that compared to their age-matched normal, what level of defect does this person have? From the grayscale, we go into the comparisons and the corrected comparisons. So here you have the raw data of the patient that is compared to the patient's age-matched controls, and you get the comparisons plot. When you see a plus sign, that means that the sensitivity of loss for that patient is less than 5 decibels, which is acceptable within the ranges of fluctuation. Whereas if a number is represented, that essentially means that there is a significant loss that is recorded for that age-matched control. If there's an absolute defect, you will see a black square that is represented here. From the comparisons plot, once the level of generalized diffuse defect, that which may be due to pupil or cataract, is removed, you get the corrected comparisons plot that has the same kind of understanding. Is there a particular pattern of defect that is generated? And that's what is represented in the corrected comparisons. From the comparison plot and the corrected comparison plot, one generates the probability plots. What is the probability of having this defect in a normal, healthy person? If the p-value is greater than 5%, the chances are this defect may be visible in a normal person. The smaller the p-value, the lesser are the chances that you can actually see this defect in a normal person. So in this case, we see that the comparison probability plot is very similar to the corrected probability plots, indicating this defect is real and is not due to a generalized loss due to cataract or media opacity. Next step is the Baby A curve. Baby A curve represents the comparison data that is obtained from the visual fields, and they are ranked from the best point to the worst point. And you have a graphical representation that looks something like this. And you have a couple of lines that is represented just about, if you can see this. If the person is a normal, healthy person, the Baby A curve should fall within the limits of normality. But if there is a diffuse defect, could be due to cataract, then you would see a Baby A curve that is parallel to the normality lines. Or if a person has a cataract and perhaps glaucoma, a region of defect would be diffuse, but then specific localized defect is also visible. Here are some examples of Baby A curve. So here's a normal patient. The lines, the Baby A curve is falling within the normality indices. Here you see a diffuse defect. This could be due to cataract. You see the BABA curve is shifted down. Here you're seeing a local defect where part of the BABA curve is normal, but then there is a sudden drop down, or you're seeing a mixed defect like that has a localized and a diffuse defect, meaning that part of the BABA curve is very parallel to the normality indices and then subsequently drops off. The globalized summary indices are number representation of the entire visual field plot. So you have the overall visual field, and right here, just below the BABA curve, you see the globalized summary indices. It looks like this. MD represents mean defect. SLV represents square root loss of variance. DD represents diffuse defect, and LD represents localized defects. The mean defect is a one number representation of the visual field that says how much defect is present in the visual field. The square root loss of variance says that how much of this visual field defect is actually sort of localized, or you see a pattern of defect. And the bigger the number, the greater are the chances of the defect being present that is localized and there is a pattern present. There are p-values given next to it, so you would know when they are significant. The diffuse defect is a number representation of the BABA curve that we are seeing, and if it's significant, the p will be less than 5%, and the localized defect says if the number that we are getting here is significant, will be less than 5%. MS represents the mean sensitivity, that is, how much and how good the person sees in decibels in overall visual field. Visual field reports can provide a lot of data, but knowing what each of these data point means can be very important and make things less overwhelming and will aid your clinical diagnosis. Thank you very much.